Welcome to the Suicide Prevention Series brought to you by the Public Hospitals Authority. I'm Aravana Apia. Thanks so much for joining us. The issue of suicide is a complex one that deserves thoughtful and informed discussion. As the month of September has been dubbed Suicide Prevention Month, I'm here to help facilitate the very complex conversations surrounding the issue. The statistics are alarming. Suicide rates have been on the rise for decades, and according to the global stats, the number of suicides recorded has doubled in the past 20 years. In the United States, more than 45,000 people die by suicide each year. That's one person every 12.5 minutes. Suicide is currently ranked among the top 10 leading causes of death, with nearly half of all suicides committed by men and women aged 30 to 64. Over the course of the next few minutes, I'll be joined by a team of experts that will help us understand the root causes of suicide, the impact it has on surviving family and friends, and how you can help prevent suicides in your community. Joining me to kick off our conversation is Dr. Tracey King, clinical psychologist and president of the Bahamas Mental Health Association. Dr. King, thank you so much for being here. So, Dr. King, give us your dictionary definition of suicide.
So the CDC defines suicide as the intent to end one's life. The definition is simple, but the issue itself is very complex and very multifactorial.
Mm-hmm. And when we talk about suicidal thoughts and behaviors, what sort of things fall under that banner?
So the suicidal thoughts are thoughts about wanting to end one's life, not wanting to live, feeling about being a burden, being in emotional pain. Whereas the behaviors itself can include whether a completed suicide, a suicidal attempt, or kind of activities that a person would do to prepare for the suicide itself.
Mm. And can you give us an idea of what some of those activities might be?
Some of those activities might be, for example, saying goodbye to their loved ones, creating a plan. Um, for example, if a person is going to end one's life with poison or getting those necessary things that they would use within the suicide itself.
Mm-hmm. And what are some of the triggers and contributing factors? You spoke to the complexity of suicide as an issue. What are some of the triggers and contributing factors to that?
So there are risk factors that the research kind of has indicated through the years. Some of those risk factors, meaning factors that will increase a person's susceptibility to suicide, that will include mental illness, a history of trauma or abuse, physical ailments or chronic illnesses, use of substances, significant loss, whether with a job or a relationship, lack of social support, sense of isolation, but also the stigma that is surrounding mental health itself that leads to a lot of factors such as not seeking help.
Mm-hmm. And you spoke to this a bit earlier, but what are some of the other symptoms or red flags that we can look out for to determine if, if we are having suicidal thoughts or if someone that we love is having suicidal thoughts or ideations?
So, suicidal warning signs or red flags can vary from person to person, but we've noticed that there are specific verbal kind of indicators, such as the person talking about ending their life, not wanting to live. There's also emotional components to that. A person talking about or saying that they're feeling depressed, sad, hopeless, helpless, feeling like they're a burden in a lot of emotional pain. So those are the emotional kind of indicators. There is also the significant change in a person's personality or behaviors, where you might see an individual becoming more withdrawn from friends or family. You'll see them not performing as well at work or at home, or even within school. You'll see an increase in sometimes risky behaviors, impulsivity, increase in substance use, but also preparatory kind of actions, such as saying goodbye, preparing for their death, like creating a will or giving away prized possessions, are just a few of those warning signs, and it can vary from person to person.
Mm-hmm. You talked about the sort of risky behaviors Does that, and how it varies, does that vary from demographic to demographic as well?
It does, and from age, from children that will do things differently than older adults. And so, what I would say when we talk about red flags or warning signs is being aware of what they are. But it's also about checking in with your loved ones and your coworkers, because if you notice a change, then I would say just kind of pay attention to those changes. Because those individuals or people that are suicidal tend to exhibit signs and symptoms. And a lot of what happens is that people aren't aware of them, or they kind of chalk it up of them having a bad day,
Right.
or not really being able to recognize what those signs are, because we always hear after a suicidal death is, I never saw that. I never would have expected that. And so being
Right.
aware of these warning signs can actually help a person, if you see them, to have that conversation, to ask that question, to encourage them to seek help.
Hmm. And speaking of seeking help, what are some of the things that people should do if they are experiencing suicidal thoughts or ideations?
So if a person is experiencing suicidal kind of thoughts or behaviors, I would always recommend to get treatment. We know that there are going to be periods where a person might be in a suicidal crisis. And those periods will vary from time period to time period. But a person who is suicidal is not always going to be suicidal. But in those moments of those suicidal crises, help is essential. That help can be in the form of calling a helpline, going to PMH, calling 911, um, seeking help in the sense of going to even talking to a friend, or having an appointment with a mental health professional. That
Hmm.
help is available, and seeking help is the essential component of dealing with any kind of suicidal thoughts and behaviors.
Right. I guess my follow up question would be is how do you have the conversation if you think a loved one is experiencing suicidal thoughts? How do you, coach them or sort of nudge them toward getting the help that they need?
So having the conversation is difficult because a lot of persons feel that they're not prepared to have that conversation because it's a heavy topic. I always say go with it in the sense of just talking to an individual, saying, "Hey, I noticed something has been going on, or you haven't been acting like your normal self. Are you okay?" Just having that "Are you okay?" question kind of opens that conversation. I would definitely not encourage a person to say you are suicidal, but just kind of have the open ended question, "How are you doing?" And they're saying they're fine. It's like, I don't think you are, because I've been noticing some things. Are you really okay?
Right.
And really just being that opening, to be that person for that individual to open up to. When we talk about just kind of having conversations with suicide, a lot of people have different opinions about it. That is not the time to start sharing your opinions. This is the time just to have an opening air and to be a support system for that individual, and to encourage them to get the help that they need.
What do we do in cases where there has been a suicide attempt? Perhaps it was unsuccessful. How do we sort of navigate the conversation with that individual after the fact? From the health professional perspective, as well as from the perspective of friends and family.
That is always a very difficult time, because those persons that have attempted suicide, that have completed it, they struggle within themselves, because it is a very difficult decision. And sometimes they feel a lot of guilt, a lot of shame
Mhm.
associated with it. So, with anybody that has attempted suicide, one, I would say continue, to go and get the help, but to also for family members and loved ones to be supportive, because that is a time where this person is dealing with a lot of emotional and mental issues. And we all need to be supportive, whether it's the mental health professional, whether it's the family or loved ones, for the individual to also be kind with themselves in this process. Because I always tell people we're human beings, we experience emotions. Life throws a lot of things at us. And if we need help and we struggle, that's just reacting as being a human being. And that's okay to get help and to struggle sometimes, but to make sure that you get to help during those struggles.
Mhm. You touched on it briefly earlier in our conversation, but I want to talk about the stigma that currently surrounds suicide and mental health challenges as a whole. So, how do we help as a community? How do we break the stigma surrounding mental health and suicide?
The stigma, however, is ingrained in every facet of our society. We see it in our normal day conversations or the things that we don't want to talk about. We see mental health issues, but we just don't speak on it. We see it in our policies. We see it in how our resources are being allocated. So when we talk about stigma of mental health and mental health issues and suicide, it's recognizing that we have to approach it in a collaborative and multifactorial way, that we have to look at, increasing awareness, education, because part of the stigma is misconceptions about mental health issues. We also have to look at the research. The research helps us to really understand what is happening within our country so that we have a better idea of how mental health issues are exhibiting themselves within the country and which avenues do we need to pursue to prevent, but also treat those issues. Other aspects that I would say is, just having a more supportive environment, because a lot of persons that are dealing with mental health issues, they are discriminated against within the workplace, when they go to different places by their coworkers, friends, family. We frequently use the word crazy. So it's also just being within ourselves aware of how we perpetuate the stigma of mental health issues.
hmm I want to touch on the issue of policy because we currently don't have a lot of policy surrounding how we deal with persons suffering from mental health challenges. What would you like to see moving forward in terms of a policy position?
I would like to see more of a national strategic plan. Um, I know that the Mental Health Act was revised. There were some deficits, but some also good areas in the act. And so policy wise, I would like to see the country within itself to move forward in a more strategic way. Um, we can always highlight the negative, but I also want to say that there are positives. And so being able to build on those positives to get rid of those negatives and the weaknesses. And one of the things when we talk about policy is, the credentialing component, but also the systematic structure of the inequality of physical and mental health in the country. And overall, when I think about change, I really want to see access in the Bahamas right now. There's a lot of centralized mental health services in New Providence. And there are a lot of persons in other family islands that have mental health issues and don't have access to those particular services. And so, even if they are flown into New Providence, there's a disruption within their life, and then they return back to the island with that lack of support. And so, I don't think it's just policy. I think it's so many aspects that we can work on, and they need to be worked on systematically and simultaneously.
Absolutely. But I want to thank you very much, Dr. King. This has been a very insightful conversation. Thank you so much for being here with us.
Thank you so much for having me.
We'll have more from the suicide prevention series in a moment. Are you or someone you know struggling with suicidal thoughts or ideations? You don't have to go it alone. You can reach out for help. Call the Community Counseling and Assessment Center at 322 3293, the Crisis Center at 328 0922, People Helping People at 698 0155, or any of the mental health professionals at the Sandlands Rehabilitation Center at 364 9600.